Welcome to day 23 of the Murphy Challenge. It's 7 steps to quit. Today we're going to be taking a look at heart treatment and heart problems and how this challenge coincides with helping our cardiovascular health. We're going to actually get the perspective of a cardiologist on what we're doing with this Murphy Challenge and how it's helping our overall health and how it can help you as well. Today is a very special day. Not only is it another day in our challenge, but I have to go and have my annual checkup with my cardiologist. If you don't know, I am a heart attack survivor. In fact, here's a picture of me when I had my second heart attack following a bodybuilding contest in which my heart stopped at one point while I was at the hospital and they had to revive me. Then here's another picture of another visit I had when I'm packing up to leave. So I've had a history of dealing with heart attacks, and so that's what prompted me to change to a whole food plant-based diet. Well, during this time, I've been dedicated to lowering my blood pressure, eating better, because I don't want to be on medicines for the rest of my life, because long-term, it just doesn't sound like something I want to try to do. Now, in one case, I have to be on blood thinners because of the stent that was put in my heart. But I don't want to have to deal with blood pressure medicines or statins, even though all those work together, I'm told. But today I want to see if my progress can give me some good news of getting rid of some medications, because I'm already at the lowest end of them because of my changes. But let's see how it all works out. They told me to bring in all my latest medicines. I have to take 4 of them all together, including aspirin, over-the-counter 81 milligrams. This is part of my regimen on a daily basis, and this is what I'm trying to challenge him to see if I can stop taking at least half of these. I'm excited about going in the sense of I want to see what my progress is, because I haven't checked my weight since we began this, the 30 days. So I really haven't checked my weight, so I'm curious about that. I'm also curious about some of the results from the labs that I took a few days back. So it's all about seeing if this journey has been helpful from a medical standpoint. 185.4. Okay.
Lift up your shirt to your chest. You can rest your arms. Take just one finger for your oxygen level. Okay. Have you been having any fatigue or shortness of breath?
No.
Any chest pain or palpitations?
No.
Pain in your legs or swelling?
No.
Feeling weakness or dizziness?
No.
And do you bruise easily?
No.
In the last 6 months since you've been here, any new surgery?
No.
And any new allergies to medication?
No. What exactly does the EKG do?
The EKG is monitoring your heart rate. It can detect any past heart attacks and stuff like that. So he's going to look at your heart rhythm this time and compare it to the last one. Make sure there's been no changes. 130 over 90.
You gotta be kidding. Really?
Yeah, that's what it is right now. Alright. And has there been any changes to your medications?
No.
Okay.
There really is a white coat reaction to your blood pressure.
A lot of people do say that, yes.
I take my blood pressure every morning, and it's like, particularly after a run, it's much lower. And I went running this morning, and it's at 130 over 90.
Yeah. A lot of people, they have, like you said, it's a lot higher when they come in, and it's normal when they are at home.
Let's take a look at what we're battling against and trying to prevent. Look at the progression of heart disease and atherosclerosis. Narrow artery leads to lack of blood supply due to the narrowing of the coronary artery, resulting in oxygen starvation of heart tissue. This causes symptoms of chest pain and tightness called angina. You can see the narrowed coronary artery. Then blocked artery leads to myocardial infarction, MI, heart attack caused by sudden insufficient blood supply, commonly due to ruptured plaque and thrombus formation. This occludes the artery lumen, producing an area of necrosis in the heart muscle. And you can see a close-up of that. And then recovery, collateral blood supply. Accessory blood supply from adjacent blood vessel travels to the region affected by the heart attack to provide fresh blood. But you can see scarred cardiac tissue. Then there's heart disease and hypertension. Hypertension is persistent high blood pressure. It can lead to increased incident and acceleration of atherosclerosis, as well as hypotrophy or thickening and dilation of the left ventricle. So we're looking at thickening left ventricle wall, small left ventricle cavity, and thickened septic wall. So the thickening of the heart becomes the situation or the problem. Now, normal heart anatomy looks like this. You can see how clean that is. Look at that artery compared to this artery, or even worse, this artery. Partially occluded or clogged up artery. So this is what it's supposed to look like, nice and clean. Cross section of it, opening of the artery. The proper thickness versus problematic thickness. Proper thickness, problematic thickness. Of course, and these are the different arteries. LCA, RCA, left, right coronary artery. These are the arteries where I had problems. Heart failure is a common debilitating condition defined by the heart's mechanical inability to pump blood effectively. The result is a decrease in blood circulation, which forces blood back up and oxygen supply to decrease in muscle and lung tissue. Excess accumulation of fluids and tissue throughout the body causes swelling or edema, which impairs the function of affected organs. Most common types of heart failure is dilated cardiomyopathy, illustrated to the right, and the heart muscle is damaged or defective. The walls in the ventricles are typically thinned and the chambers are dilated. And then there's mitral valve prolapse. Actually occurs when they're all four leaflets. And finally, we have the aging heart. The natural progression of aging affects every part of our body, including our heart. Just like the changes that happen to the rest of our bodies, the changes that happen to our heart are an adaptation due to our age and lifestyle as we get older.
You're feeling well?
I am, Doc. I've been actually the last few, I've been doing a 30-day challenge where I've been doing pull-ups, push-ups, and squats.
Mm-hmm.
And so I've been working on my blood pressure and all that kind of stuff. It's been, it was 130/90 here, but it's been much lower than that at home. But
good.
But I was kind of wondering about my lab results, but that's telling me, and just
So
basically giving an idea.
You've trimmed your body weight down 5 pounds compared to the last visit.
Okay,
Great.
cool. So I was like at 190 last time, so I'm down to 185. Okay, that works.
Yeah, it's always nice to keep yourself trim. Let's see what today's EKG shows.
Okay.
It shows a normal sinus rhythm, and it shows some T-wave abnormality in the lateral leads, the anterolateral leads. So that T-wave abnormality is not new, but let's compare it to your last year's EKG and see how that looks. It was present on the previous electrocardiogram. White blood cell count, the hemoglobin are normal. Your red blood cells are a little enlarged. I don't think that's of any important significance. Your platelet count is normal. So the white count, the red count, and the platelet count look okay.
Okay.
Your serum creatinine, a measure of kidney function, is a little bit high. Your creatinine is 1.4. Upper limit of normal is 1.7.
I'm actually taking creatine for my supplement. Would that do that?
That could contribute to
Okay.
it. And the reality is many African American men have higher serum creatinines. I think it's probably because they have more muscularity.
Okay.
But that's the reality is they do. So we measure your GFR, which is a measure of kidney function, and your GFR is normal. So your creatinine tends to be a little high, but GFR is normal, and that takes into account your age and also your ethnicity.
Okay.
Your general chemistry looks good. Liver enzymes, all those things look fine. Your total cholesterol, 137. The LDL, which is the bad cholesterol, is 61. So that's where we would like it to be, and your HDL is 65. So I think the lipid profile is ideal. You had a PSA done as well, prostate-specific antigen. That's elevated at 8.9, upper limit of normal being 4. So I'm not sure what that signifies. I don't know if we've done it in the past. I don't find a previous PSA.
Okay.
So that's something that needs to be followed up on.
Okay.
So generally refer to a urologist for urologic follow-up.
Yeah, I mean, I'm literally doing 100 pull-ups, 200 push-ups, and 300 squats. I'm running like a mile before it, and I'm doing that, and I'm running a mile after.
How many pull-ups are you doing?
100, like I do 10 rounds. So I did 10 pull-ups, 10 push-ups, 10 squats, and I do that 10 rounds, and then I do a mile afterward. So I'm not feeling bad at all in any shape or form.
I can believe that. Paul gave us a pretty listen to your heart sounds. Deep breath in. And out. And again. How long does that workout take?
About an hour.
So you're moving along. You're really moving along. Yeah. Mine's not as vigorous by a long shot. Your exam is normal. I mean, the only thing abnormal is your intense or your extreme muscularity. And I think the atorvastatin is working great to control your cholesterol.
Yeah, so I'm not in any position to start taking anything away then, huh?
Oh, it's looking also good. Why
mess with it?
Why
right?
mess with it? It looks good. I mean, you look really well. You look fit as can be. And I'd like you to follow up with one of these doctors for the PSA. I don't know which could see you soon.
PSA is what you call it. PSA.
Yeah, prostate-specific antigen.
Gosh, with all the stuff that I do, it makes you think, is this plant-based stuff even worth the effort, maybe? But it's gotta be, right?
How can you argue with the results you're seeing?
I guess I get bogged down by like, okay, now we did the colonoscopy, though that was clear.
Yeah.
But now I might have a prostate challenge. I'm like, golly, man, like what is this?
It's living. It's it's each of these challenges, dealing with them, making sure they're treated and moving on. What else is there? Acknowledging it, facing it.
But I guess if I'm not doing what I'm doing, it would make it even worse, huh?
Paul, you look great. You have no idea what I see over in the hospital. Please keep doing what you're doing.
Okay.
You have no idea. I mean, you are so different than the average person that I see in the hospital or that I see here in the office. And you've been in the waiting room. You know what it's like.
Yeah. Well, the last thing I expected was to be concerned about another type of test, but at least I'm told that what we're doing is helping. On to the next challenge, right? On to the next challenge. So now we've seen some examples of how heart health can be improved with the proper diet and with the proper exercise, and that even when you conquer one hill, there may be another hill to climb, but that's what we all have to face. It's never just one battle. It's always something else in the war to fight. But better to go down swinging than just give up and succumb to it. See you when day 24 comes around. I'm Paul Williams, 7 Steps to Quit.